I'm fine. My brain feels great.
You took a nasty spill on the ice. We need to get you checked out and make sure you're okay.
Olivia O'Connor, yeah? Hi, my name's Dr. Angiogram. How about you come back with me and we can figure out what's going on?
Okay.
I'll wait here for you.
Okay, Olivia, can you just confirm your date of birth for me, please?
August 5th, 2000.
And your age?
16.
Okay, so I heard you took a nasty fall the other day, so we're just gonna do some basic diagnostic tests to make sure nothing concerning is going on. So first, I'm just gonna take your blood pressure. You can stick your arm out for me. Okay. Okay, a little high, but nothing to be concerned about, just 130/80. Next, we're gonna check out your breathing. So if you could take a deep breath in and out. One more. And out. Okay, everything sounds good there. I'm just gonna check out your ears quickly. Okay. And the left one looks good too. I'm just gonna check your eyes quickly. Okay. So far everything looks fine. Just a little high blood pressure. However, I did notice a little lag when I was checking out your eyes. So I'm just gonna call Dr. Noma from upstairs. She's a neurologist who specializes in concussions, so she's gonna check you out. Oh, there she is now.
Hi, I'm Dr. Melanoma, and I'm here to perform your diagnostic concussion tests. I'd like you to follow these pencils. Dr. Angiogram, could you bring Grace with you?
Yeah.
Alrighty, I am diagnosing Olivia with a concussion, and I would recommend that she stops all physical activity, stops using electronic screens, and lessens her homework.
But what about my HBS assignments?
No, it'll be okay. It's just until your symptoms improve and I can clear you. So, Grace, before you guys head out, I would like you to read this pamphlet. It lists some of the instructions for you so that way you can make sure that Olivia stays safe.
Okay, you guys can follow me out.
Thank you.
Thank you, Melanoma.
Yeah, Megan, I'm still not feeling good. I'm constantly dizzy, blurred vision, I'm throwing up, and my balance is totally off, and I'm falling down, but that happens to me all the time anyways. Well, my doctor let me use my phone on dim lights, so I guess that's good. I gotta go. I gotta work on the HBS I missed.
Hey Olivia, how you feeling?
Still not feeling pretty good. I still feel like...
Like what?
Who are you?
What?
You're not Grace.
What are you even talking about?
You're an imposter.
Get out! Get out! Okay, so my friend is having like a psychotic break or something. I don't really know. She's chasing me with a spoon. I don't even know what's happening. But you need to send help. You need to send help right now. I don't know what's happening. You need to help her. She was diagnosed with a concussion, but this does not seem right. Send help.
Where are you, imposter? Where are you? What have you done with Grace? Imposter!
I need to find her! I need to find her!
It's okay. It's okay.
I need to find her!
This does not seem like a concussion. Last week she was a normal 16-year-old, not one who just went on a psychotic break with chasing her friend with a spoon.
Yeah, I know. I'm gonna order an MRI while she's sedated so we can figure out this problem.
Yeah.
Hi, Grace. I'm Dr. Melanoma. I think we met about a week ago. I'm here to talk about what happened. Would you be comfortable talking with me about the incident?
Yeah, I don't know what happened. I walked in to check on her. You know, Olivia had a concussion. You diagnosed her, and she was completely fine. And then all of a sudden, she looked at me, and she got the weirdest look on her face and said I wasn't Grace. She obviously knew somehow that I was Grace, but she said it wasn't. I don't understand what happened. She called me an imposter. I don't even understand what happened. Does this have anything to do with her concussion? I don't understand.
It might be. That's why we're doing some diagnostic tests like an MRI. And once we look at those, we will try to get to the bottom of this because we will get to the bottom of this, I promise.
But it was just me. She was talking to other people and she was completely fine. I looked in on her in her room and she was completely fine. but it's just me. She has this reaction. It's all my fault.
No. We will figure this out. I promise.
Dr. Noma, the MRI scans are out.
Hopefully we'll be back with some answers. It looks to me like there are multiple lesions on the brain here. Some are newer than others. I can definitely see the newest ones caused by hitting her head on the ice the other day.
It looks like she has had past head traumas that have not been medically documented.
Based on all this information and her symptoms, I think it might be Capgras syndrome. I can't believe it. I heard all about it in med school, but I never thought I would actually treat it.
Is that related to Alzheimer's?
In some cases, yes. The severed connection between the occipital lobe, specifically the optic nerve, and the amygdala can be related to Alzheimer's, but I don't believe that is the case here based on her age and head trauma.
Oh, that makes sense. She can't get the emotional response she normally receives when seeing her best friend Grace because her emotional center, the amygdala, cannot connect to her vision, causing her to believe that her friend has been replaced by an imposter.
Exactly. I believe she has suffered concussions before but was never treated, so the lesions have been building up in her brain, and this last fall was very bad and caused even more lesions to form that finally severed the connection. Hey Olivia, I hope you are doing better today. After consulting with your MRI results, we have reached a diagnosis. Thank you for your patience and faith in us as we have been working through this diagnosis. I understand it's been a very difficult time for you.
I just want the imposter gone and Grace back.
Grace has been very worried about you. If it helps, she even volunteered for a comprehensive comparison against her own medical and dental records. It checked out.
That's so good. I think she was replaced with an evil twin named Chloe, so that's really good to hear.
Olivia, we have diagnosed you with Capgras syndrome. This syndrome is extremely uncommon, and you did not have the correct symptoms until after we had diagnosed you with a concussion. You had nausea and vomiting, balance issues, vision trouble, and overall classic concussion symptoms.
A week after your visit, you showed the defining symptom of Capgras syndrome. You thought someone close to you, Grace, was an imposter.
There was significant damage to your optic nerve connection in the amygdala, the emotion center, so you were unable to connect seeing Grace to the fact that she is your friend. The lesions found in your brain also affected your stomach's ability to contain the stomach acid, as the brain had difficulty sending messages to the lower esophageal sphincter. Your balance has also been affected from the lesions on your cerebellum, the part of the brain that controls the balance. The receptors in the cerebellum are damaged, and you are not able to detect the shifts in body positioning and cannot send signals to the muscles to adjust accordingly. The vision problems also arise from the injury to the occipital lobe that controls the vision in the brain and the optic nerve that takes sensory information to the occipital lobe. The brain is unable to deliver the sensory information to the occipital lobe to be processed, so visual acuity may be blurry.
Thankfully, there have been some relatively recent breakthroughs in treatment for Capgras syndrome. Your psychiatrist will explain to you how the drug risperidone can help you. This is our preferred course of treatment over all the other surgical options because you are a younger age of our patients that develop Capgras.
I don't care. Do whatever you need to do. I just want Grace back.
Of course you do. We also need to have a talk about your concussion history. The lesions on your brain could not have occurred from just one concussion. This is an extreme situation, but your case only accentuates the need for athletes to report head injuries.
Well, I do fall a lot and hit my head, but I don't ever want to say anything because I keep wanting to train and do my homework. I don't want to stay home and rest.
Here is a referral to a highly knowledgeable psychiatrist, Dr. Claustrophobia.
Thank you. I'll check him out.
Olivia, have you been taking your medication daily? This drug, risperidone, helps regulate the dopamine and serotonin in your brain. These neurotransmitters help regulate your mood and behavior. The drug can also prevent your severe anxiety when Grace is around.
Yeah, Dr. Trophobia, I feel much better. I don't feel like I have to chase Grace around with a spoon anymore.
And I do appreciate that.
That's progress. These meetings will also be very helpful in your recovery, Olivia, because we will try and reestablish the emotional connection that you have to Grace so that you are able to recognize her without thinking that she's an imposter. It's a generally new treatment, but there has been high rates of success.
Sweet.
Awesome.
I was Chloe all along.